Today's topic, bone spurs. Bone spurs are bony projections that develop along bone edges. Bone spurs, osteophytes, often form where bones meet each other in your joints. They can also form on the bones of your spine. The main cause of bone spurs is the joint damage associated with osteoarthritis. Most bone spurs cause no symptoms and can go undetected for years. They might not require treatment. If treatment is needed, it depends on where spurs are located and how they affect your health. Where can bone spurs grow? Although they can grow from any bone, osteophytes are particularly common in the foot, especially the heel spurs or calcaneal spurs, big toe and ankle, hand or finger, hip, knee, neck, shoulder, spine. Symptoms. Most bone spurs cause no signs or symptoms. You might not realize you have bone spurs until an X-ray for another condition reveals the growths. In some cases, though, bone spurs can cause pain and loss of motion in your joints. Causes. Joint damage from osteoarthritis is the most common cause of bone spurs. As osteoarthritis breaks down the cartilage cushioning the ends of your bones, your body attempts to repair the loss by creating bone spurs near the damaged area. Some people have bone spurs and don't even know it. Spurs start to create symptoms when they put pressure on nearby nerves, restrict movement, rub against other bones or tissues. When that happens, you may feel some knobby or bumpy areas, especially in the fingers or toes. Numbness and weakness, especially in the legs if the spine has spurs. Pain near the affected joint, like heel pain. Reduced range of motion, how far the joint moves. Stiffness. Tendinitis, swelling of a nearby tendon. Tendon tears, like a rotator cuff tear in the shoulder. What are treatment options for bone spurs? Bone spurs are treated only if they are causing symptoms. Initial treatment is directed toward decreasing inflammation and avoiding rangery when possible. Local cold application can help when the location of the bone spur is accessible. Anti-inflammatory medications, administered both orally, over-the-counter NSAIDs, and by local steroid injection, Canalig, Dipomedrol, Sealstone, are commonly used, depending on the location of the spur. Local mechanical measures, such as orthotics, or shoe inserts, and local bone spur pads might be considered, depending on the location of the bone spur. Bone spurs that are causing irritation of nerves, tendons, or ligaments and that are resistant to conservative measures can require surgical operations for treatment.